Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with the August 13th, 2020 COVID-19 update from the Dubuque County Public Health Incident Management Team. Dubuque County has added 50 new cases since Monday when I gave my last update and 20 since yesterday. As of Thursday, August 13th at 2 p.m., Dubuque County has had 1,734 positive COVID-19 cases. A total of 31 COVID deaths have occurred in Dubuque County. 8% of the over 21,000 people tested in Dubuque County have been positive overall since March, and yesterday's positivity rate was 12%. The 14-day average positivity rate is 11%. And as of yesterday, 13 Dubuque County individuals are currently hospitalized in Dubuque County. And about 65% of Dubuque County positive cases have recovered to date. The state added 1,266 cases since Monday and 635 since yesterday. The reporting has been somewhat sporadic due to the storms around Iowa, but they're starting to catch up. As of August 13th, 2020 at 2 p.m., Iowa has a total of 50,337 positive cases. In all, about 1 in 6 Iowans, or over 538,000 people, have been tested, and about 9% of Iowans tested have been positive. Yesterday's positivity rate was 6%. Deaths reported in the state total 957 Iowans. And currently, 261 cases are hospitalized throughout the state, and that's up 37 since Monday. Finally, about 78% of Iowans have recovered. So we're kind of at a crossroads here. Our communities are making some changes and implementing some strategies, like the face covering ordinance in the city of Dubuque. We know this will reduce some risk, but certainly not slow the spread by itself. In the meantime, we continue to go out in public, to events, retail stores, and even bars where physical distancing is minimal at best. Some are protesting the mask requirement. I know some people do not agree, but public health officials are confident that simple public health measures of mask wearing, hand washing, physical distancing, avoiding crowds, doing things outdoors instead of indoors will work in slowing the spread and reducing the number of infections and deaths if we all do them consistently. In the meantime, tools to stop this pandemic and new infections are still being developed, and there are many things we don't know. We don't know how long immunity lasts. Is it short-term or lifelong? We don't have a vaccine yet, and even with an approved vaccine, time will be the true test of its effectiveness. We don't know when the next wave or surge of cases will hit. Even though we've learned that weather is not a factor, we've based many of our predictions and planning on past influenza pandemics, which have some similarities with SARS-CoV-2, but also have differences. And we continue to research the effectiveness of all the different types of masks. One more thing on masks. Monday, I reviewed the new City of Dubuque ordinance requiring face coverings in certain situations. Needless to say, we're getting quite a few questions regarding if masks or face coverings are required in certain situations. Although the ordinance is pretty comprehensive and covers a lot of places and situations where face coverings are required, it certainly can't cover every possible thing. So here's my advice. If you're not sure whether you need to wear a mask in a particular situation, go ahead and wear one. Why not? What's the harm? There's no rule that says it's illegal or not okay to be extra cautious. It's kind of like the food safety saying when you're wondering if something is safe to eat because it's been sitting around too long or wasn't prepared safely. Don't eat it, or when in doubt, throw it out. Likewise, if you're not sure whether you should wear a mask, wear one and be on the safe side, and continue to maintain distance from others. In the news, we've heard Russia has approved and will begin administration of a coronavirus vaccine to teachers and medical workers, even though Phase 3 trials are just beginning and will be conducted on only 2,000 people. This is far fewer than the other phase 3 vaccine trials underway. This is one area where an abundance of caution is definitely called for. As Dr. Anthony Fauci said just today, having the vaccine and then proving it's both safe and effective are two different things. Quite a few vaccines are in different phases of development and human trials around the world. We can't predict if or when they'll be ready for general population use, but it's likely there will be several different vaccines that are approved. And production will take some time, so when a vaccine first becomes available, it will be prioritized for those who need it the most. Finally, here's a great tip from my friend Tom at Clark University, especially for those of you in the workplace or who spend a great deal amount of time inside. Clip your mask to your lanyard. That way, you'll always be prepared. Have a great weekend, everybody. Do things outside. Stay safe, and remember, we are all in this together.